basically, when you're looking at the eye, as I told you, the light goes through the cornea, it bends, and then it passes through the clear transparent lens, which is right here. And as I told you, if this lens becomes opaque, it's like your hair going gray, right? So the proteins within the lens get denatured with age. And again, given a long enough life, all of us will develop a cataract. Okay, there's nothing myths के आप ये दवाई डाल लीजिए, homeopathic scenario or Ayurveda or Drishti or whatever it is, it does not stop or retard the progress of cataract. Now, what this lens, if it becomes opaque, this will stop the light from going in and this will not reach the retina. So now what you have to do for this lens is that this needs to be taken out. And this has to be replaced by an artificial lens which comes and sits exactly at the same place. Okay. So this is a clear transparent lens which is put at exactly the same place. Now, when you were doing earlier the cataract surgery, this lens was removed, or this opaque lens was removed as a single piece. Okay, this was called as intracapsular cataract extraction. That means there is a capsule which surrounds the lens. So if you imagine, say, a mango or any phal, any fruit, it has a covering, like a coconut has a covering. So the entire thing was taken out as one single piece. So that was called as intracapsular cataract extraction. And then the person was made to wear thick glasses because this has a power. The lens has a power. So then the people, if you have seen old movies, etc., so you had people wearing thick soda water kind of soda glass lenses, which were like a +10 or something like that. Then what came was that you removed this cataract and you leave the outer covering, that means the capsule, and then you implant a lens in there. So this was called as an IOL, intraocular lens. That means that you are putting a lens within the eye. Okay. And you used to remove the cataract as an extracapsular. But the main bulk of the cataract, the nucleus was a single piece. So if you have to remove something which is big, you needed a bigger incision. So the incision was about 22 millimeters, 20 to 22 millimeters for you to take out this lens as either as an intracapsular or even an extracapsular. It shrunk a little bit, but still it was a large incision. Now what happened was that this guy was called a maverick, Charles Kellman. So in the 60s, he said, can we break this cataract into small pieces and suck it out? Okay, so the word that came in was Phacoemulsification. So Phaco means lens in Greek, and emulsification means, like in Big C, you are emulsive, so you're making the lens into an emulsification. So, and you are sucking it out. So therefore, the incision through which you put a needle, which is oscillating or moving at the speed of sound, it's not ultrasonic, but it's moving at the speed of sound. That's why we call it as ultrasonic phacoemulsification. So it cracks the nucleus into small pieces. There is constantly fluid coming into the eye and it is being sucked out gently. Okay. So the incision shrunk. So the incision came down to 3 millimeters. Nowadays we work on even 2 millimeter incisions. So you are able to put a titanium needle, break the cataract into small pieces, and without letting the globe collapse, you are also sucking it out. So stitchless surgery. Okay. Apart from stitchless, we can now do these surgeries only with drop anesthesia. Earlier, people were put to sleep.
Correct.
Under general anesthesia, the surgeries were done. Then it moved on to local injections. There used to be an injection given here and an injection given here so that the eye person is not able to squeeze, or the lids, etc. But now we do it just under topical anesthesia. Topical means drop anesthesia. So if you do it under drop anesthesia, you don't need to tie a bandage. Because if you had given an injection here, the movement of the lids was paralyzed for 6-8 hours. So you needed to put a bandage. Okay. So you don't need a stitch, you don't need any injection, and you don't need any bandage. So it has become a walk-in, walk-out surgery. No stitch, no injection, no pad, cataract surgery.
Follow Center for Sight and post your queries to get answers from the experts.